Hello everyone, I am Dr. Parag Telang. I am the founder and director of Designer Bodies, our Center for Advanced Cosmetic Surgery located in Mumbai, India. We often get inquiries from patients who have had some kind of trauma. Now this trauma could be due to sports injury, it could be due to some kind of burns or keloid formation, and all of this leads to a loss of the ear. Now the loss of the ear could be either partial or it could be a complete loss. When we have a patient who has just had some kind of trauma or accident to the ear, the treatment is called as the acute or immediate treatment. Now this could involve cleaning the part properly. Sometimes we try to resuture a part of the ear which has been cut. Patients with keloid need sometimes steroid injections which contain something called as triamcinolone to cause the keloid to shrink in size. Once the healing of the acute or immediate event has happened, we normally ask the patient to wait for 3 to 6 months. After the 3 to 6 month period is over, the tissues have healed, there is no infection in the local area, and tissues are now ready to get operated. If you need a reconstruction of the ear, the best option is still your own rib cartilage. There are a lot of artificial materials such as Medpore and Supor, but they all have a very high chance of infection and rejection, especially in a patient who has had an acute injury to the ear. Therefore, your own rib cartilage remains the gold standard in reconstruction of the ear. Especially when you need to reconstruct only a part or a missing part of the ear, the rib cartilage gives us that more flexibility of design, so we can exactly recreate what we need to recreate. Now the surgery, as you all know, is done in 2 stages. In the first stage, the new ear is going to be carved from your rib cartilage and that is inserted in the correct location. We need to wait for 3 to 6 months for this ear framework to start getting blood supply from the local area, and 6 months down the line we'll release the framework and create the gap behind the ear. So that's how we can reconstruct a damaged or post-traumatic defect of the ear in 2 stages. When I look at the experience of the past 11 years, I can tell you with great confidence that your own rib cartilage is the safest option of ear reconstruction, especially in those of you who have had some kind of trauma. Now, if the local skin is not available or has been badly damaged, in some patients we need to use a fascia from the scalp, that is called as a temporoparietal fascia. So in these scenarios, there is an incision in the scalp and we take out a piece of this fascia, and that is then used to cover the ear framework. But whether it is a ear framework which needs to be done partially or in totality, rib-based cartilage is the best option for ear reconstruction. Post surgery, after your ear has been reconstructed, we need a period of around 1 month where you need to be little protective of your new ear. Being protective means not to sleep on the ear, not to do heavy lifting of weights, and to avoid activities such as swimming. So basically don't do anything which can cause any kind of trauma to the ear. For the ear and the local tissues to be strong and natural like the other side, it takes around a month or so. After a month, you can resume all your dietary things, all your exercises and swimming, everything can be resumed normally a month later. The final shape of the reconstructed ear starts being visible at the end of 2.5 to 3 months, and that is the reason we normally recommend that you wait for at least 6 months before undergoing the second stage. This allows a lot of time for the blood vessels to grow, for the sensations to come back, because ultimately the aim is that the ear should completely match your opposite ear, not only in appearance but also in the color and the sensations. So that's how ear reconstruction can be done in a case of post-traumatic ear defects. So if you have any queries related to your ear reconstruction, please free to comment in the comment section below or write to us and contact us.